Meantime, local vaccine providers are preparing to vaccinate children ages 5 to 11 with that Pfizer COVID shot. It comes as the vaccine cleared its first major regulatory hurdle yesterday, with that FDA advisory panel voting to recommend the vaccine. A CDC advisory panel is set to meet next week, and it would likely discuss the vaccine then. And if it all goes as expected, kids could be getting that shot late next week. WCNC Charlotte's Chloe Leshner is joining us live from StarMed's vaccine clinic in Northwest Charlotte. So, Chloe, really a lot of things that parents have to consider here, weighing the options. What do they need to know?
Yeah, well, just like with adults, some parents want to go out and get their kids vaccinated immediately. Others have some concerns about the safety. But a doctor with Duke Health who actually helped run the Pfizer trial in kids says they looked very carefully for side effects, and he feels confident that this is the best way forward out of the pandemic.
Lydia's here for science.
7-year-old Lydia is a piece of the science, paving the way for a Pfizer COVID vaccine in children ages 5 to 11. Science doctors say is necessary.
You did great, sweetie.
Children make up at least 25% of all COVID cases.
So in total, we've had about 6 million cases in children. But I just want to point out that the impact is much, much greater in children than in adults with the Delta surge.
Lydia and her younger sister, Bridget, two of the more than 2,000 kids in the age group who took part in the Pfizer trial. Some questioning why something tested on thousands should be given to the 28 million American kids in that age range.
We have to look at this vaccine in total. With the millions of doses that have been administered to adolescents and adults, that we can be reassured by that.
Dr. Chip Walter directs the Duke Vaccine and Trials Unit. They took part in the Pfizer Kids trial. He says they looked closely for side effects, specifically myocarditis. The inflammation of the heart muscle has been reported mainly in adolescent boys after vaccination.
It was examined for quite closely in the trial, and there were no cases.
If approved by the FDA and CDC, the dosage given will be a third of what people 12 and older get. But just like adults, it would be 2 doses given 3 weeks apart. Doctors say getting kids vaccinated will keep them protected from hospitalization and the possible complications and long-term effects of a COVID infection.
Of course, it's a leap of faith, but it is the only way we're going to end up ending this pandemic. You know, to talk about super spreaders, I call children the silent spreaders. We know now, again, from study that 50% of these kids are asymptomatic, but they're still able to transmit.
And I'm told about 1,300 appointments are already pre-booked here at StarMed for this age group. And other vaccine providers in our area have been preparing for this age group to be approved for weeks now. Again, the CDC is meeting next week. Live in Charlotte, Chloe Leshner, WCNC Charlotte.
Chloe, thank you for that report.